Welcome to my presentation of cirrhosis of the liver. What is cirrhosis of the liver? If we dissect the word, cirro means orange or yellow, and osis has to do with disease, condition, or increase. Hepatic refers to the liver. Cirrhosis is a chronic degenerative disease in which normal liver cells are damaged and are then replaced by scar tissue. Etiology, cause of disease. Long-term alcoholism is the primary cause of cirrhosis in the United States. Chronic liver infections, such as Hep B and Hep C, are commonly linked to cirrhosis. Liver injury, reactions to prescription medications, exposure to toxic substances, and repeated episodes of heart failure with liver congestion can also cause cirrhosis. Obesity has recently been recognized as a risk factor in non-alcoholic hepatitis and cirrhosis. Poor nutrition increases a person's risk of developing cirrhosis. The disorder can also be a result of diseases that run in families, inherited diseases, like Wilson's disease, hemochromatosis, glycogen storage disease, galactosemia, and cystic fibrosis. The liver has a couple types of cirrhosis. Portal or nutritional cirrhosis is the form of the disease most common in the United States. About 50 to 30% of all cases of cirrhosis are this type. 9 out of every 10 people who have nutritional cirrhosis have a history of alcoholism. Portal or nutritional cirrhosis is also called Leydig cirrhosis. I might have butchered that, by the way. Biliary cirrhosis is caused by intrahepatic bile duct diseases that impede bile flow. Bile is formed in the liver and is carried by the ducts to the intestines. Bile then helps digest fats in the intestines. Biliary cirrhosis can scar or block these ducts. It represents 15 to 20% of all cirrhosis. Various types of chronic hepatitis can cause post-necrotic cirrhosis. This form of the disease affects to about 40% of all patients who have cirrhosis. And disorders like the inability to metabolize iron and similar disorders may cause pigment cirrhosis, which accounts for 5 to 10% of all instances of the disease. Demographics: twice as likely to occur in men than women. And here is a chart for different countries around the globe, and male and females, and it's the proportion of deaths related to different types of necrosis from different reasons. And this is a map from 2017, and it's population, if you see the numbers here on the left, per 100,000. So the colored countries with dark reds and oranges are the ones that have more deaths. Russia, Mexico looks bad, and it looks like some in the Middle East as well. So here we have pictures of healthy liver, fibrotic liver, cirrhotic liver, and then sometimes liver cancer. Cirrhosis changes the structure of the liver and the blood vessels that nourish it. The disease reduces the liver's ability to manufacture proteins and process hormones, nutrients, medications, and poisons. Cirrhosis gets worse over time and can become potentially life-threatening. This is a picture of the liver, gallbladder, aorta, hepatic veins, portal veins, and the liver is also part of the digestive system. I like this picture. Happy liver, not happy liver. Signs and symptoms. Symptoms of cirrhosis are usually caused by the loss of functioning liver cells or organ swelling due to scarring. The liver enlarges during the early stages of illness. The palms of hand turn red, and patients may experience basically this list of things. As the disease progresses, the spleen enlarges and fluid collects in the abdomen, forming ascites, and legs edema. Other symptoms can occur from the liver not processing ammonia, intoxication from the liver not processing correctly, and ammonia intoxication and the failure of the liver to convert ammonia to urea. High protein intake in these patients can also lead to these symptoms. Mortality rate. The CDC states deaths per 100,000 population are 13.1. That was 2017. And currently, Medscape states that cirrhosis of the liver is the 9th leading cause of death in the U.S., responsible for 1.2% of all U.S. deaths. I should say disease cause. Diagnosis: lab tests, imaging, and biopsy. So the lab tests are performed to test the function of healthy liver cells in the urine and blood. Test liver function. CT can help determine the size of the liver and indicate healthy and scarred areas of the organ. And liver biopsy is usually needed to confirm the diagnosis of cirrhosis. A tissue sample is removed with a needle and then examined under a microscope. Treatment. The goal of treatment is to cure or reduce the condition causing cirrhosis, prevent or delay disease progression, and prevent or treat complications. Salt and fluid intake are often limited and activity is encouraged. Iron supplements, diuretics, antibiotics may be used for anemia, fluid retention, and ammonia accumulation associated with cirrhosis. Liver transplants can benefit patients with advanced cirrhosis. Treating underlying disease. There's also some alternative treatments, homeopathic medicines, such as dandelion and rock poppy, milk thistle, which I usually find these in different types of teas. Cirrhosis-related liver damage cannot be reversed, but further damage can be prevented by patients who eat properly, get enough rest, do not consume alcohol, and remain free of infection. The end.